So Hershey, luckily, is motivated by food, very important. And if you notice, this is a two-person job. So the therapist is walking behind Hershey, making sure that Hershey doesn't go off. And the therapist is up front, continuing to keep Hershey exercising. Hershey doesn't even know that he's exercising. This is Clara, a very, very osteoarthritic dog. And, you know, she feels pretty good. She actually came into rehab in a cart. And the first place she felt comfortable was in the underwater treadmill because we were able to keep the water warm, make sure all of her joints that were submerged were feeling good, promoted elasticity of her muscles, etc. This is Hershey early on going through the cavaletti rails. Notice how they are crooked on an angle. And Hershey's picking up the feet higher than he was on the treadmill. And again, we love it when we have a food-motivated patient because that absolutely helps get them through. But rehab is definitely a team effort. Now, if you just sort of know, now Hershey has had a haircut, and look, we've been able to raise the level of the cavaletti rails. Looks like a much different dog. And it's not just a haircut. I mean, Hershey's definitely improved over time. Still occasionally will bang a rail, but hey, that's a lot better than Hershey did when Hershey first came in. This is Ella. We're going to show you how she dives underneath. Again, she would never do a play bow, but we're going to make it fun. Again, we love a food-motivated Labrador. Ella looks happy with her tail wagging. She doesn't know that she's working. She just thinks that she's getting treats. And this is a really incredible exercise for elbow osteoarthritis after we have sufficient pain medication on board. That's paramount. This is Hershey doing stand-to-sit exercises. The technician in the back is keeping the feet from splaying out, which happens commonly in our older patients because they don't have the muscle mass. And we don't even need to get Hershey to sit all the way down on the floor. We just need to control the movement, soft landing, and we're promoting gentle down and up without the legs splaying. All right, here's Belle, or Rolo, and we're on the air mattress, so dig it out of the basement. And he doesn't know that he's exercising. Oh, yeah, it's Rolo because he has a shaved leg. So he's just excited to stand there and get treats, but he's exercising. He's using a lot of muscles that he wouldn't normally use just standing on the ground. Hershey again, trying to do the same exercise. And look how difficult it is for Hershey to actually walk on that. So you can see just through these videos that a simple exercise like this, and okay, you don't have to run out and get an air mattress, especially if you live in an area that you have a small apartment, but in the fall, we're coming into the fall season, walk through leaves. In the snow, walk through snow. In the summer, walk on the beach, walk through tall grass, gets them to use their legs. This is Kelly, and if you notice, the rehab technician is just gently swaying the hips. That's it, but we're targeting left and right, and the dog is actually doing the combined exercise of the plank. All right, here's Hershey going through the cones, not exactly a super athlete, but I bet Hershey hasn't seen a bend like that in a long time. But again, we love our food-motivated animals. Sometimes we have the owners not feed them before they come to rehab. These are the cookie stretches that are going either to the shoulder or the hip. And we can do that very, very easily at home. Now, I'm putting this slide, this last movie in here is Ella. And Ella's owner used to say, I don't want to bring her to rehab because she gets so stressed. And, you know, maybe the first couple of times until we get our appropriate nonsteroidals, pain management, and get them feeling good. But animals really love exercising and feeling better. And Ella would come in and just sort of flop on the floor and feel good. So rehab definitely, when we get our pain medications on board, is the mainstay of getting these patients back on their feet, literally.